Why would you want to release the front and back of the hips? From back here, you have the nerve roots that are going to go to the legs from the sciatic network, the glutes being tight, the trigger points in the glutes, the front of the pelvic floor with the appendix on the right side, the descending colon on the left side. If you do a basic myofascial release to the area between the SI joint, the sacroiliac joint, and the front of the pelvis, that's going to help unwind things like old scar tissue from appendicitis, hip impingement, that snapping hip syndrome, opening the fascia to the blood flow to the whole lower leg. So to do that, you're going to sandwich the tissue. You find your depth. You're going to glide your hands opposite, up and down, find the easy way, left and right, and find the easy way, or pick a twist, clockwise, counterclockwise, and vice versa, to find the easy way. So you're going to find your depth, you're going to test your glides, and you're going to find the easy ways, and you're going to hold it. Make sure you're keeping your depth between your hands. You have the colon, the circulation that's getting to the legs, the whole sciatic network to the legs. Hold for 10 minutes. Common symptom that people have is what they call iliotibial band or IT band snapping and pain. A lot of times that is because the pelvic bone, the ilium, is tipped forward or back, and it changes the alignment of the IT band. More times than not, you have an over-recruitment and a really tight adductor. So people that are crossing their legs all the time and keeping that tight, an old groin pull, then over-recruits here. So you get tight hip flexor through here. You get pain. So you get pain in the IT band, but really you have a tight hip flexor. You're not using your hamstrings. You're over-recruiting your adductors, and often there's a pelvic ilial fascial restriction through here. So doing a basic myofascial release, nice long hold, unwinding the whole fascial of the pelvic bowl, an old food poisoning, an old, gluten intolerance, SIBO, anything that has to get around through the ileocecal valve can be sticking to that right hip flexor, pulling that anterior ilium. So holding a good 10 minutes here can help common problems such as sciatica, IT band, even foot and ankle problems because of the lack of blood flow from here. If your body has inhibited muscles because the hip flexor is grabbing all the time, stuck to the colon fascia, can't recruit the hamstrings, over clenches the glutes, and you're doing it on purpose, squeezing your glutes like a good PT student, not going to cut it. Open the fascia around here, open the shins, free up the whole fabric for the blood flow and the nervous system to get through the whole leg. Also doing this fascial release to the hip and SI joint is going to help upregulate parasympathetic or ventral vagal, social, comfortable, somatic experience of the body.